Namaste and a very warm welcome to you all. Today we observe World Trauma Day. To guide us on this topic, we have with us Dr. Prathamesh Raut, who is a consultant and head of Department of Emergency and Trauma. Dr. Prathamesh, this is the first question to you. What is trauma in our life? And why do we observe World Trauma Day on 17th October every year?
World Trauma Day was first observed in 2011 in New Delhi because there were more number of patients losing their lives because of road traffic accidents in India. Thereafter, we observe World Trauma Day every year on 17th October. We take it as an opportunity to create awareness about the trauma and the traumatic deaths and this traumatic event which has a more impact on the life of the patient and their families, so that we can educate people that how to tackle about this traumatic patients and how to make them aware about the areas where they can be taken for better care.
As you said, sir, like trauma refers to the family. So trauma refers to the emotional, psychological or physical response to an event that is deeply distressing or disturbing. Please let us know what exactly does trauma mean.
Right. So the word trauma per se has been originated from Greek word which means injured or wounded. Today, initially, I would say that trauma used to be only dedicated to physical injuries, but today it has been expanded to include psychological injuries, to include emotional injuries, and of course, the physical injuries include as the major term. So, if you talk about trauma today, it can include abuse, it can include disasters, it can include physical injuries, and others means which causes harm to the patient.
Okay. After you elaborated what trauma means to us, could you just let us know what are the prevalences of trauma in this area?
Right. If you ask me about the prevalence of trauma, you can see around 50 lakh people approximately die because of the traumatic injuries worldwide. In India, 10 lakh people have lost their lives because of traumatic injuries. And around total hospitalization annually is around 2 crore Indian peoples due to traumatic injuries. So do you know 58% of these deaths are actually preventable if these patients are taken in time in a proper center where they get a proper treatment for their traumatic injuries. 58% is a major chunk. We can decrease the mortality and morbidity of these patients. I think that is the importance of the World Trauma Day, so that we can educate people about preventing these 58% of the deaths.
As you said that there is 58% avoidable deaths. So could you just enlighten us that a patient who are critically injured should receive immediate medical care within 60 minutes of the injury to prove their chances of survival? What is golden hour and how does it improve the outcome of trauma patient?
Yes, so if you ask me about this golden hour concept, it is the first critical hour after injury or impact. So the concept is that if the patient who is suffering from trauma, if they are taken into a proper trauma care center in the first hour, we can decrease the morbidity, mortality of the patient. We can improve their lifestyle. We can decrease the amount of impact financially and medically that the patient will have, and also that will be shared with their families. So the golden hour concept is very important to decrease the traumatic problem to the patient, decrease the morbidity of the patient, and give patient a better life after he has suffered from the traumatic injuries.
As you said, in the specialized trauma center, the care has been prioritized. So could you let us know the difference between a trauma care in a specialized trauma center and a smaller medical facility? Can it be significant, which is impacting the patient outcome? What is the difference between these two centers, sir?
So if you ask me about trauma centers have specialized checklists, they have specialized trauma teams, and this checklist, these protocols and these teams ensure timely and adequate response towards these trauma patients. So the team includes trauma surgeons, orthopedicians, trauma trained intensivists, trauma trained ER physicians, and all paramedic staffs, which are all specially trained to handle these trauma patients. And this robust team ensures all the adequate timely care which is required to this trauma patient to be given in the golden hour itself. This drastically decreases the mortality of the patient, morbidity of the patient, and we can give a better life to the patient after he is discharged from the hospital. So that is basically the difference what a trauma care center makes, and it stands different from the other centers which are not specialized in trauma care.
Thank you, Dr. Prathamesh, for giving us information on trauma and trauma care on this World Trauma Day. So, the take-home message for every one of us is we should understand the importance of trauma and trauma care in the specialized center, and we should always follow the golden hour during any traumatic event. Thank you.
Thank you.